All right. I will call the Health and Human Services Committee of the Wayne County Commission to order. So welcome, everyone. Chanel, is that you to do the roll call?
Sherelle, yes, I'm here.
Thank you, Sherelle. Please.
Commissioner Marecki,
Here.
Commissioner Dobb,
Here.
Commissioner Anderson,
Here.
Commissioner Baker McCormick,
Here.
Chair Colleen.
Here.
You have a quorum present.
Thank you. What's next, Madam Clerk?
B, approval of the July 7th, 2020 meeting minutes.
So moved.
Thank you, Commissioner McCormick.
I'll
Is there
support, I'll support Dobb.
Thank you. Any additions, corrections, changes, comments on the minutes? We have a proper motion. We will do this one by voice vote. All in favor of adopting the minutes of July 7th, please say aye.
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 Opposed? It was unanimous. What's next, Madam Clerk?
Item C1 under old business, the Wayne County Human Rights Ordinance.
Thank you. We're still working on a few things on that. We still have a few changes to make. It is not ready to come back right now. Hopefully in 2 weeks, we will have it. There's some wording issues. Of all things, there's an issue about real estate that I've been talking to some realtor organizations about that we got to get right in there. So there's a few things. I'm also reaching out to get an attorney from either Fair Michigan or Equality Michigan, attorneys that have looked at all of these ordinances that have been happening in other communities, because I need a sign off there also that our ordinance does it. So with that explanation, I think the proper motion is to pass this for the day, so it's automatically back up on our agenda 2 weeks.
So moved, Anderson.
Thank you, Commissioner.
Support, Marecki.
Thank you. All in favor of pass for the day, please say aye.
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 Opposed? Abstentions? Okay, so we'll revisit in 2 weeks. Madam Clerk.
Item D1 under new business, requesting commission approval of a gift with Balmar Giving.
Okay, I see that's in Bellevue, Washington, so that's got to be that Steve Ballmer guy from Microsoft. Who from administration wants to tell us about this 200 grand and what we're going to be using it for if the commission accepts this grant?
Hi, this is Carol Osterberry, Health Officer with Health, Human, and Veteran Services.
Welcome, Ms. Osterberry. Thank you.
Yes, and as you said, this is a grant from Steve Ballmer, a private foundation that is the owner of Microsoft. And for the COVID-19 response, this foundation is giving grants for projects for COVID-19 in the city of Detroit and Los Angeles. They reached out to one of the executives in Health and Human Service or Health, Human, and Veteran Services. And so we, talked to them, and this is going to be used. 100,000 for face masks for children, and those will be distributed in the impoverished communities, and 100,000 for the Save a Life program, advertising, printing, communication. Those are, the plasma donation for someone who has tested positive for the antibodies to COVID-19.
Okay. Anything else, Ms. Osterberry?
No.
Okay. Let's go to some questions on commissioners. I'll keep following the same pattern. So, Madam Vice Chair, I'm looking at you. Commissioner Baker McCormick, do you have questions on this?
No, I have none. Thank you.
Thank you. Commissioner Anderson.
Nothing at this time.
Commissioner Dobb.
Thank you, Mr. Chair. Carol, when you say the impoverished communities, is that just areas in the low income census tract?
Yes, that's exactly what we used, and I apologize, I thought I had that list, but yes, the communities there in the low economic
Right.
for the census, exactly.
And then how exactly will the masks be distributed?
You know, we are going to be able to use our point of dispensing system where we have those point of dispensing locations set up throughout all of our communities. You know, I know like which we actually activated and used. I don't know if you all remember like last summer when we were passing out the water filters for a lot of those, you know, communities, Melvindale, Highland Park. So we have those locations set up. We know how the traffic flow goes. You know, it's a good, well process, and you can use those sites for, you know, lots of different dispensing opportunities.
And one thing, I'm sorry, I'm not sure if it was in the packet. Are these disposable masks or reusable?
They will be reusable.
Okay. All right, great. Thank you. That's all I had.
Thank you, Commissioner Dobb. Commissioner Marecki.
Thank you. Commissioner Dobb just asked one of my questions. I'm all set.
All right, thank you. When you say distribute to children, Ms. Osterberry, what's the parameters around that?
That would be the children who are in elementary school, that K through 8th grade.
But we're
That's
not going to schools, correct?
No, we are not planning on going to schools, no.
Is
But
it easy? Is
if
it
that
easy
were
enough
a
for you to?
way-
I'm sorry. Go ahead. I'll let you
What I'm
finish.
saying is, yeah, if it were brought to our attention that, hey, it would almost be better if you went to the schools, we certainly can, you know, readjust our distribution plan. We're not like just married to only using those pod sites.
Do we have any idea how many masks 100 grand buys these days?
25,000.
Okay. Is it easy enough for you to send us a list of what those contact points are?
Meaning in the, where the pod?
Yeah, you used a term that I wasn't exactly
Oh, I'm
sure
sorry.
of.
Point of distribution site.
Yeah, can you send us a list of those?
Yep.
You gonna have any trouble distributing 25,000 to kids?
I don't think so.
Okay.
And actually, I think this is, yeah, I mean, if a parent comes up and says, can I have, you know, 2 or 3, it's not going to just be 1,
Yeah.
even though they will be reusable.
Right. Okay, good. And we're doing this in Out County, Wayne, because the city of Detroit has their own grant from Balmer Giving.
I don't know that the city of Detroit got a grant. I don't know that they didn't. But yes, we are looking at Wayne County.
Okay. And one more time on the other 100,000, we're going to be able to do what with it?
Sure. That's going to be used for advertising for our Save a Life program. And the Save a Life program is advertising for people to go to the American Red Cross if they have tested positive for COVID-19 antibodies, part of why we're doing both the antibody and the diagnostic test over at Garden City Hospital. And then you can donate plasma, which has been, they're finding is a very, very effective clinical treatment for someone when they are diagnosed as COVID-19 positive.
Well, that's a very positive use of the money. What's the pleasure of the committee on this item?
Mr. Chair, I have one more.
Yes, sir. Commissioner Anderson?
Commissioner Dobbs' questions, I guess, stimulate another question on my behalf. Would they be, Carol, will they be distributed at particular sites? Is that what we're being told, that like it would be the Western Wayne location where you're located, and possibly the Family Center in Inkster, or?
Right, exactly. We, you know, all of those locations, and even like, you know, it was mentioned schools. I mean, we will be making sure our distribution is making it very convenient for families to come and get the masks.
Okay, because as you know, and some commissioners may not be aware of it, that the city of Inkster does not have its own school district after the legislature took action a number of years back to close down the Inkster School District. So as far as school distribution, it'd be difficult to figure out how.
Sure, exactly. Yep.
Because those kids from Inkster are spread among about 4 different school districts.
Yeah. And we also have the Western Wayne Family Healthcare Clinic, that's not far from here over on Hamlin Road.
Right. Yeah. Okay, that was all I had. Thank you.
Oh, you're
Thank you,
welcome.
Thank you, Commissioner Anderson. And again, Commissioner Anderson, the department is going to send us a list of what those points of contacts are, whatever the term is. I'm not using it correctly, for where these are going to be distributed from. So you'll get a list to be able to know where the distribution of these masks is going to be taking place.
Just one last thing, Carol, if you could, I don't know if you're within your department, if you could put together a little flyer that you're going to use so we can disseminate that in the community too.
Absolutely. Yep. When we get to that, absolutely. We will.
Thank you.
Yeah, and especially the reminder on if you have antibodies.
Right.
Mhm.
Yeah. Okay, what's the pleasure of the committee on this item?
I move approval.
That was Commissioner Anderson.
I'll
Yes.
support Dobb.
Thank you. Anderson moves, Dobbs supports. I'll go around the table. We'll, your vote, Vice Chair Baker McCormick
Yes.
and Commissioner Anderson
Yes.
and Commissioner Dobb,
Yes.
Commissioner Marecki,
Yes.
and Colleen votes yes as well. So it's unanimous. Next item on the agenda, Madam Clerk.
E, such other matters as may be properly submitted before the committee.
I know of no such. Do any commissioners or administration have any other matter that they would like to present at this time? Hearing none. Next on the agenda, Madam Clerk.
Public comments.
Do we have any emailed in comments? Anybody mail in the email comments?
I haven't.
No, sir.
Okay. Is there any member of the public on the phone that would like to have comments to the Health and Human Services Committee? And I think people can just speak up, unmute themselves and speak up. Is that true?
Yes.
Any member of the public zooming in with us today that would like to have comment? One last call. Any member of the public that would like to have comment for the Health and Human Services Committee? Hearing none, Madam Clerk,
Adjournment.
committee.
So moved. Marecki.
All right, Commissioner Marecki, and I will
Support.
rule that without objection, we stand adjourned. Thank you, everyone.